A heart attack, or myocardial infarction, is a dire medical event where blood flow to part of the heart gets obstructed. This blockage disrupts the heart's functioning, causing damage to its muscle. If not attended to immediately, this condition can escalate to dangerous, life-threatening levels. Insight into heart attacks, their symptoms, their triggers, and methods to prevent them is crucial for heart health and can act as a lifesaver. Imagine a harsh, acute pain in your chest radiating to your arms, shoulders, jaw, neck, or back. This discomfort, often depicted as a feeling of intense pressure, tightness, or squeeze, is a characteristic symptom of a heart attack. There could be other indicators like in breathing, excessive sweating, or feeling dizzy, but it's vital to remember these symptoms are not set in stone. They can fluctuate in intensity. Some people might mild signs, whereas others may demonstrate severe, pronounced symptoms. Interestingly, the manifestation of these symptoms can also differ based on gender. Women are more prone to experience unconventional symptoms such as nausea, excessive fatigue, and stomach aches. The range in symptoms make it essential to stay informed and proactive about heart attack signs. A heart attack, also known as myocardial infarction, is a medical emergency that occurs when blood flow to part of the heart is blocked. Now, let's delve into the root causes of heart attacks. The primary cause, leading the notorious list, is coronary artery disease. This is a grave condition where the arteries, which are essentially the critical lifelines that supply blood and oxygen to the heart, become narrow and hardened. This dire state of affairs is the result of the buildup of cholesterol and other substances. These substances, collectively known as plaque, wreak havoc on the inner walls of the arteries, gradually restricting the flow of blood. This obstruction not only limits the vital supply of oxygen and nutrients to the heart, but also sets the stage for potential heart attacks. However, coronary artery disease isn't the only culprit. There are other significant risk factors that contribute to the onset of heart attacks. High blood pressure, for instance, exerts an undue strain on the heart, forcing it to work harder than normal. Diabetes, on the other hand, wreaks havoc on the body's ability to process sugar, resulting in damage to the vessels and nerves that control the heart. Then there's the lethal habit of smoking, which introduces dangerous chemicals into the bloodstream, thereby damaging the heart and blood vessels. Furthermore, stress, often overlooked, also plays a key role in escalating the risk of heart attacks. Chronic stress triggers the body's fight or flight response, which in turn raises the heart rate, blood pressure. Lastly, a family history of heart disease can also significantly raise your risk. The genetic factors inherited from parents can predispose individuals to heart disease. Even stress and a family history of heart disease can raise your risk. But here's the good news. Heart attacks can often be prevented. We're now transitioning to the incredibly crucial subject of prevention, a topic that holds an immense significance in this discussion. The first and foremost preventive measure that comes to our mind is adopting a balanced and nourishing way of life. This implies making conscious choices each day that contribute to our overall health and well-being. In order to delve into this, let's first talk about your diet. A diet that is balanced and nourishing consists of various food groups that together to keep your body functioning optimally. This includes the consumption of a broad range of fruits and an array of colorful vegetables, both of which are rich in vitamins and essential nutrients. Lean meats should also be included in your meals for the much-needed protein, along with grains that provide complex carbohydrates, essential for sustained energy throughout the day. Moving on, the importance of regular physical activity cannot be emphasized enough. Regular exercise not only keeps your heart strong, but also helps in maintaining an ideal weight. It assists in managing stress levels, reducing the risk of developing other health complications as well. Moreover, if you're a smoker, quitting is imperative. Smoking increases the risk of heart disease by damaging the lining of your arteries, leading to a buildup of fatty material which narrows the artery. Furthermore, if you have conditions like high blood pressure or diabetes, managing them effectively can significantly reduce your risk of a heart attack. In conclusion, a heart attack is a serious medical condition, a potentially life-threatening situation that occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off entirely. This blockage is often the result of a buildup of fat, cholesterol, and other substances which form a plaque in the arteries that feed the heart. The resulting damage or death of part of the heart muscle is what we know as attack. The symptoms of a heart attack vary from person to person, and they may even differ between men and women. Typically, symptoms can include discomfort in the chest, feeling lightheaded or dizzy, experiencing shortness of breath, and breaking into a cold sweat. Some people may experience a feeling of doom or feel like they have the flu. Others may feel extreme fatigue, nausea, or a sudden heavy pounding of the heart. While there are several causes of heart attacks, the major ones often range from having coronary artery disease to suffering from high blood pressure, high cholesterol levels, obesity, diabetes, and smoking. Even like stress and excessive consumption of alcohol can contribute to the risk of a heart attack. Yet, the good news is, with the advancement of medical science and a greater emphasis on living a healthy lifestyle, the risk of a heart attack can be significantly reduced. This includes adopting a balanced diet, engaging in regular physical activity, managing stress, avoiding tobacco and excessive alcohol, and maintaining a healthy weight. Furthermore, if you have existing health conditions like diabetes or hypertension, it is particularly crucial to manage them effectively under the guidance of your healthcare provider. Regular checkups, adherence to medication, and lifestyle modifications can go a long way in reducing the risk. Remember, if you are at risk or have a family history of heart disease, it is absolutely essential to discuss this with your healthcare provider. Monitoring your health regularly and making informed lifestyle choices can make all the difference. After all, when it comes to your heart, every beat counts.